So today we will see the X-rays of lower limb. Okay, radiology portion. So most of the lower limb radiographs, they are taken in these views: anterior-posterior view, oblique view, and lateral view. Okay, these are the points we have to remember during describing a X-ray. One X-ray must come in your OSPI questions. Okay, so whichever X-ray you are given, you have to first describe the X-ray, point out the structure pointing, and answer the related questions. Okay, so first you have to know whether it is a plain X-ray or contrast X-ray. Generally here you will see the plain X-ray. Contrast X-ray examples are the barium solo X-ray or barium contrast X-ray or IV intravenous pyelogram, like this. All these are contrast X-rays. Okay, so generally we here use plain X-ray. Next we go to view of the X-ray, whether it is anterior-posterior view or oblique view or lateral view. Next we go to the region. X-ray of which part? X-ray of pelvis. In for lower limb we will see X-ray of pelvis or X-ray of the knee joint, X-ray of the ankle joint, X-ray of the foot. Like this you will see. Okay. And bony part and soft tissues, what bony part you can see and what soft parts you can see, that also you have to tell. So X-ray of the pelvis showing the acetabular cavity, head, neck and upper end of the femur, like this you have to describe. Okay, so a single line description of X-ray will be: it is a plain X-ray of anterior-posterior view of the pelvis showing the hip bones and upper end of femur containing head, neck, two trochanters and upper part of shaft of the femur. Like this you have to describe. Okay, understood? See here, first one is plain radiogram of pelvis, anterior-posterior view. Okay, it is also showing the lower lumbar region and the hip joints. Okay, see what structures you can see here. This part is ilium. Okay, here is the ischium, here is the pubis. Here is the acetabular cavity where the head of the femur is articulating to form the hip joint. This is neck of femur, this is greater trochanter, here is the lesser trochanter of the femur, and this is shaft of the femur. This foramen is the obturator foramen. Okay, and this is symphysis pubis, pubis of two hip bones are joining here, and this angle is the neck shaft angle, angle between the neck axis and the shaft axis. Here is the neck shaft angle. Okay, understood? So you will be able to identify different structures. So I is representing ilium, A is acetabular cavity, GT is greater trochanter, LT is lesser trochanter, P is pubis, PS is pubic symphysis, OF is obturator foramen, IP is istiopubic ramus. Here is the ischium and connecting ischium and pubis, istiopubic ramus. IS is ischium, here is the ischium, and NSA is neck shaft angle. Okay, so these are the structures you are seeing in plain X-ray of pelvis AP view. Okay, next we go to sentence line. This is an important radiological feature. It is a line at the upper margin of obturator foramen that becomes continuous with the shadow of inferior surface of neck of femur. Here, upper margin of obturator foramen continuous with the lower margin of neck of the femur. Okay, understood? This continuous line is known as sentence line. And the medial border of shaft of femur till the lesser trochanter shadow. This is lesser trochanter. Another line can be drawn along the external border of the ilium. Here, along the external border of the ilium, another line can be drawn, an upper border of the neck of the femur, upper border of neck of femur and external border of the ilium. This is not sentence line. This line is known as sentence line. Okay. In case of fractured neck of femur, this line will not be continuous. Okay, we will see fractured neck femur X-ray is there. So these two lines are not altered on change of posture, but discontinuity in the curved lines is seen in fracture of neck of femur or in dislocations of the hip joint. Okay, this is asked in your OSFI question. Next is neck shaft angle. Neck shaft angle can be visualized when the foot is slightly turned medially and its measurements varies between 120 degree to 135 degrees. Okay, when it is less than 120 degree it is called coxa vara, and when more than 135 degree it is coxa valga, depending upon the age, pelvic width and the stature of the patient. The shadows of trabeculae caused due to pressure present a peculiar pattern and help in assessing the amount of calcification of the. See here this linear pattern. This linear pattern is showing the trabeculae. When it is more white, there is more calcification. When it is more black, there is less calcification. Okay. In elder females, generally during osteoporosis, this whiteness will decrease. Okay. It will be more radiolucent, more black. Next we go to, so we have discussed hip joint and pelvis. Next we go to knee joint. Okay, so this is the X-ray of knee joint anterior-posterior view and showing the shadows of lower end of femur, upper end of tibia and fibula. Okay, so what are the structures present here? Shadows of lower end of femur, shadows of upper end of tibia and fibula. Rounded radio-opaque shadow at the lower end of femur superimposing the lower end of femur is that of patella. Here one more radiopaque area you can see, triangular. This is patella superimposing over the lower end of the femur. Okay, F is femur lower end, LC is lateral condyle of femur, MC is medial condyle of femur, T is tibia, FL is fibula, IA is intercondylar area of tibia. Okay, there are two tubercles in the intercondylar area, and JS is joint space. Here, this radiolucent area in between two bones where synovial fluid is lying and menisci are lying. This is joint space. Okay, joint space is about 3 to 5 millimeter. Okay, understood? So all this structure you will see in anterior-posterior view of X-ray of knee joint. This is lateral view. Lateral view X-ray of knee joint. Here you can see the patella separately and lying in front of the femur. So this is lower end of the femur. Here the condyles are superimposing one over the other. Okay, medial and lateral condyles are superimposing over each other. This is patella. This is upper end of tibia. Here you can see this part is tibial tuberosity and this is fibula. Upper end of fibula articulating with the tibia. Okay. So in lateral view, shadows of lower end of femur, shadows of upper ends of tibia and fibula. F is femur lower end, T is tibia, FL is fibula and P is patella. All these structures you will see. And these are soft tissue shadows of muscle, skin, fascia like this. Okay. Next we go to ankle joint. Okay, so we have discussed hip joint. After that knee joint, next we go to ankle joint. Ankle joint, this is supero-inferior view. Okay, this part is the ankle joint. You can see the tarsals. Here are the tarsals. These are the metatarsals and these are the phalanges. Okay, MT is metatarsal, P is phalanges. Here these are the cuneiforms. Medial, intermediate, lateral cuneiform. N is the navicular in front of head of talus. This part is head of talus. And this is cuboid in front of the calcaneum. This is anterior part of calcaneum. In front of it lies this cuboid. Okay, and this is medial malleolus at the lower end of tibia. This is lateral malleolus at the lower end of the fibula. Okay, and here all the bones are superimposing. That's why so white you can see. So all these structures you will see in supero-inferior view of the ankle joint. Okay, so you have to identify. These are plain X-rays only. Identify the view, anterior-posterior view, lateral view or oblique view. Okay, then have to identify which structures are showing. So another things you will see are sesamoid bones here. Just beneath the head of this first metatarsal, two sesamoid bones you will see. Okay, these are also weight bearing points. You have seen schematic diagram of foot. TL is talonavicular joint here. talonavicular joint in between talus and navicular. CC is calcaneo-cuboid joint here. Calcaneum and cuboid. In between these two, C calcaneo-cuboid joint. Next in lateral view, this is lateral view of the ankle joint. This is lower end of tibia, here is lower end of fibula. This is talus, here is the calcaneum. In front of head of talus, here is the naviculars. In front of calcaneum, cuboid. These are the cuneiforms. Three cuneiforms are superimposed, and here are the metatarsals. They are also superimposing. These are the phalanges. Okay, so all these structures you will see in lateral view. So P is phalanges, MT is metatarsal, CU is cuneiform. They are superimposed. N is navicular, C is cuboid, calcaneum, talus, tibia, and fibula. Okay, all these you will see in lateral view. Okay, all these are normal X-rays. In case of fracture, you have to detect the fracture line. Or in case of any deformity, that also you have to detect. You know the normal shape of the bone, so when abnormal X-rays will be given, you will be able to identify. Next we go to pathological X-rays. See here, here you will see the dislocation of the left hip joint here. This is the hip bone, ilium, ischium, pubis. This is acetabular cavity. This is head of the femur. You can see head of the femur is not lying within the acetabular cavity. It is displaced posteriorly. Posterior superiorly actually. Okay. And here you can see there is breach in the sentence line. So this lower end of neck of femur and this upper end of obturator foramen, they are not forming a continuous line. Okay. So this X-ray is of dislocation of the left hip joint. You can identify it. Next we go to fracture of neck of right femur. Okay, this is X-ray of the pelvis showing the hip bones, upper end of femur including the head, neck, greater lesser trochanter, shaft of femur. This is acetabular cavity. Here head is located within the acetabular cavity, but you can see there is a break or fracture line here present near the neck of the femur. Okay, here also there is breach in the sentence line. You can see this two ends of the fracture, they are superimposing, and there is a sharp margin you can see here, and it is you can see this part is displaced upward and this part is displaced downward due to body weight. Okay, so this continuous line is breached. Continuous line was formed by upper end of obturator foramen, lower end of neck. Okay, so this is X-ray of fracture of the neck of right femur. Next we go to fracture of shaft of right tibia. Here you can see this is tibia and this is the fracture line, and fracture is also displaced, and fracture is occurring at the junction of upper 2/3 and lower 1/3 of the tibia. Okay, understood? Next we go to fracture of posterior part of calcaneum. Here is the fracture. Posterior part of the fracture of posterior part of the calcaneum. Due to fall over the hill, this fracture generally occurs. Okay. Next we go to fracture of fifth metatarsal bone at the base. So from here medial to lateral you will connect, you will count first, second, third, fourth and fifth. Here near the base, this is styloid process of fifth metatarsal. Here you can see the fracture line. There is a black line here that is normally not present. So this is fracture at the base of the fifth metatarsal. Okay, understood? And here sesamoid bones are more prominent. See this rounded structure just below the head of the first metatarsal. These are the two sesamoid bones. Okay, in the tendon of flexor hallucis brevis. Okay, understood? Okay, now we will see the X-rays present in our department. You will be able to see from here or you want to come here? Medial, here also lateral medial condyle of tibia. These are intercondylar area and containing intercondylar eminence. Okay, and this is the joint cavity. Okay, containing the synovial fluid, meniscus, like that. Meniscus are cartilage plates, so you will not be able to see them, cartilages. And these lines are trabecular lines. You can see here, fine lines are there. These are the trabecular lines. and this is cortex of the bone, and this part is the medulla containing, this is bone marrow, actually bone marrow. So this is more black than the outer lines. Okay, understood? Okay, that's all. This X-ray is done. Okay, and also you have to tell the side. Side is written here. This is right side. Here also this is of right side. And you can also mention the name of the patient, age of the patient, and sex of the patient. Okay, this is X-ray of Aradha Laha, 11 years female patient of this joint containing all these you can write, but main points you must write. Okay. Here also this is a X-ray of right side, right leg, also showing the lower end of the knee joint and the ankle joint also you can see here. This is tibia, fibula, lower end of femur. Here also this is 11, this is also X-ray of Aradhyalaha. Okay. 11 years female. So you can see the epiphyseal lines at the upper end, at the lower end also. Okay. See, there is another epiphysis for this malleoli. This is medial malleoli, lateral malleoli, and these are the tarsal bones. Here they are superimposed. Here also you can see one epiphysis for posterior end of calcaneum also is present. Talus, calcaneum, navicular, like this. Okay, understood? Okay, so this is a X-ray of pelvis and the upper part of thigh. Okay, so like this you will be given in your exam. It will be pointed as A, B, C, D, like this. You have to identify the point. This is head of the femur, this is epiphyseal line, this is greater trochanter. Okay, this is, here is another epiphyseal line, lesser trochanter, neck of the femur, shaft of the femur. Okay, like this. These are the obturator foraments, ilium, ischium, pubis, symphysis pubis. This is sacrum, and above will be the lumbar vertebrae. And here also you can see ilium, ischium, and pubis also have not fused with each other. Okay, and this is the shaft of the femur you can see. So X-ray of the pelvis showing all these structures, AP view. Okay, and plain X-ray. Okay, so X-ray of the foot. Okay, this is anterior-posterior view, and this is a oblique view. Okay, this is not lateral view, because in lateral view all the metatarsal will be superimposed. You will not be able to see. That's why generally for foot AP view and oblique view is taken. Okay, so in AP view tarsals are mainly superimposed here. Here you can see the head of the talus, calcaneum, cuboid, navicular, medial, intermediate, lateral, cuneiform. These are the metatarsal, first, second, third, fourth, and fifth. Here also you can see for the, and these are the phalanges. You can see there is phalanges are short long bone, so they have only one diaphysis, one epiphysis. For phalanges the epiphysis is present near the base. Okay, and for the metatarsal epiphysis are present near the head, but for the first metatarsal epiphysis is present near the base like the phalanges. That's why first metatarsal is called modified phalanx. For hand also, for foot also. Okay, here also you can, these joints can be asked. Which joint is this? We have discussed in X-rays. You see, ball এটা কি আছে? Talonavicular, talus and navicular. Here is calcaneocuboid. Okay, so these two joints you may be asked, and they are together forming the mid-tarsal joints. Okay, you have read in lecture class. Here also you can lower end of tibia, fibula, talus, calcaneum, navicular, cuboid, three cuneiforms. These are the metatarsals, first, second, third, fourth, fifth. These are the epiphyseal center here near the head, here near the base. All these phalanges near the base. Okay. All these were of right side. Okay. Here it is left. It is written here. Okay. Right, left you can determine sometimes, but sometimes you cannot determine from the X-ray plate. So you have to read. Whatever is written, that is correct. Okay, so this is X-ray of left foot, epi view and oblique view. Okay, so here you can see also the talus, calcaneum, navicular, cuboid, medial, intermediate, lateral, cuneiform, all those metatarsals, first, second, third, fourth, fifth, and these are the phalanges. Okay, and these white areas are the joint spaces. Okay, and these are the epiphyseal lines. Okay, understood? And in OSPI, you may be asked time of fusion of these epiphyses. These are important. Okay. And here also you can see navicular, cuboid, cuneiform, metatarsal, phalanges, okay, talus and calcaneum. Okay, understood? You will be able to see somewhat bone epiphysis at the base of the phalanx. এটা হচ্ছে proximal phalanx of the great toe. এটা proximal phalanx of second toe. Okay. Okay. So that was of patient 9 year and 11 year. Okay. This is adult patient. You see the age 62 years. Okay. So here epiphyseal lines are fused completely. So this is X-ray of knee joint showing lower end of the femur, two condyles, medial lateral condyles, upper end of tibia also showing the condyles, medial lateral condyles, intercondylar eminence containing intercondylar uh, eminences, and this is upper end of fibula forming superior tibiofibular joint, and this black area is the joint space. Okay, and this prominent point here is the epicondyles you have seen in read in femur. Okay, and here it was sometimes given in your exam, superior tibiofibular joint, type of joint may be asked like this. Okay. Okay, so you will be able to identify and see here the it is more white. Okay. Here the patella got patella superimposed. Okay. Both knees are there. Only AP views here. This is left side, this is right side. Okay. You read the X-ray carefully. Here only left knee. AP view, lateral view. In lateral view, you have to identify the patella properly. Okay, and it so lower end of femur condyles are superimposing, upper end of tibia here also condyles are superimposing, intercondylar area. This is upper end of fibula, superior tibiofibular joint. This is tibial tuberosity anteriorly. Here also you can see medial lateral condyle of femur. This is superimposed patella, upper medial and lateral condyle of tibia, intercondylar eminence. This is joint space, upper end of fibula articulating with the lateral condyle of tibia forming superior tibiofibular joint. Okay, understood. And this is bone cortex and this is the bone marrow area. Okay, medulla. See, you compare, this is more white here and this is black. So person to person there is variation according to the calcification of the patient. যার যত ক্যালসিফিকেশন কমে যাবে তত কালো হতে থাকবে হ্যাঁ হ্যাঁ in females mainly osteoporosis occurs after menopause after 50 years generally there is gradually decreasing bone density. Okay, that's why there is more chance of fracture. Okay, understood. Okay, so that's all these x-rays we have for lower limb in our department. So you have to identify and write down related question. And in OSPI, you must be given one x-ray plate. That may be from different areas, maybe from supex, maybe from infex, maybe from thorax. Okay, all classes you have done, radiology is complete for 3 parts. Okay, understood? Any queries? Okay. Okay, and you read the fusion, time of fusion of different epiphyses. Okay, mainly near the knee joint you read, near the hip joint you read. Okay, okay, that's all. And the joints in the foot, metatarsal, subtalar, all those is given actually. Inversion, eversion, all those given in your auspicuation. Also important for your theory. Okay, normal X-rays.